the American Dental Association actually has done studies on piercings, and there's some alarming results. Some of the problems that we've seen with piercings is that it's not a regulated process. So you don't have dentists and you don't have physicians that are actually placing these prostheses or piercings. And what tends to happen is that with it not being regulated, we don't know if there are sterile techniques being used. And also, because you have people who are not healthcare professionals or trained to know where anatomical structures are, we see problems with bleeding, we see problems with infection, and we see problems with broken teeth, and we also see problems with speech. Been cases where patients have gone to emergency rooms from tongue piercings where they would have swelling of the tongue, which would then cause obstruction of the airway, which is and at that point you have a life-threatening condition that has to be taken care of immediately. Patients developing problems or becoming easily transmitting diseases. For instance, when you have an open wound in your mouth, you have the possibility of coming in contact with other people that under normal circumstances you may not contract certain diseases. It would be much easier, or would be a vehicle. That piercing could be a vehicle to contract diseases. There are many things such as hepatitis, HIV, many a host of other infectious diseases that could potentially be exaggerated or with the tongue piercing. We just feel that it's a serious situation that can cause some major health problems. We tend to see patients that have tongue piercings too that have speech problems. It's a definite causes problems with certain sounds like thes and t's and s's because the tongue has to rest in the back of the anterior teeth of the top teeth, and that when you don't have the proper tongue placement, you get some speech impediments. One of the big things we see beyond the infection aspect is breaking of teeth, because you actually have a hard ball that is actually, or what I call a barbell, that's actually on the tongue piercing itself, or the rod or the shaft, and patients can have broken teeth from this, and we see chips and different things like that. One of the biggest concerns is asphyxiation or choking, because patients tend to sometimes leave these in and don't take them out, so they can be sleeping or different things, and can possibly come off. Patient can then swallow it; it can become lodged in the throat. So it's a potential choking issue as well. So we highly recommend that our patients read all the facts and see possibly the results of what can happen with a tongue piercing. Lips creates a problem as well, because the lips also, many times, you have to have an anchor to hold it in place, and so you tend to see fractured teeth, cracked teeth, and also, once again, infection. You basically, when you have a hole that is placed through the lip, you can have people that may not have complete healing, that may have scar tissue that forms, that can lead to infection, can lead to swelling, and can lead to numbness. And that's another thing with the tongue piercing, is that some patients, if a vital nerve or nerve endings are hit, then you can actually have possibly permanent or temporary paresthesia, meaning that the patient won't be able to feel their tongue. Now, when a patient can't feel their tongue, that not only is their tongue, but it also affects their taste. They won't be able to taste certain foods because the taste buds are located on the tongue, and also they won't be able to tell between hot and cold. So a lot of times these patients can receive some pretty bad burns because they can't tell if something's hot or cold or not. So like I said, with all of the negative things that can happen, that's why we really try to educate our patients before if they're contemplating having a tongue piercing or a lip piercing, to just look at the facts and look at what the sequelae, look at what the possible ramifications are if they proceed with this. So we highly recommend that the patients do not do this.